Hi guys. Well, a little bit. It's been a crazy, crazy year for
I
sure.
guess I guess we're not some of those practices that have all the time in the world to
Yes.
choreograph dances and
Yes. Getting these videos in is
it's hard.
hard.
It
We
is
are
very hard.
busy for sure. But today we wanted to talk about a hot topic kind of on Instagram. You've probably been seeing lots of people showing their international trips to countries to get hair transplants and their whole transformation. But hair has like really come into the focus recently.
Yeah, I mean, even if you watch the Super Bowl, there were the amount of commercials on hair vitamins or hair supplementation.
Mm-hmm.
It's a problem. I mean, and I think in a society where um, we are concerned with our appearances, or if our confidence level is based on maybe hair. Also, there's so many medications out there that can cause side effects of hair loss. The biggest thing now is the amount of people that are on GLP medicines or the weight loss medicines, so that there is a known that you can lose some hair with that.
Yeah, with weight loss in general, you can lose some hair. And like even since COVID, right, hair has been talked about a lot. And it's
Mhm.
always been kind of an issue that's talked about amongst men, but we've seen a lot in the recent years about women talking about it as well.
Yeah, and it can just be a shedding, right? So if you're finding yourself in the shower, more and more hair is coming off pillow. I mean, my wife will ask me if I'm stressed based on what my pillow looks like at home. So
And how much hair
and
you're
how much
shedding.
hair I'm shedding. So it's everybody is affected by it. Also, just based on hormonal, as we age, we
Mm-hmm.
tend to see a decrease in our hormone levels,
Genetics play a big role in it as well.
which will cause you to lose hair at a faster rate. And there's the thing. What can you do for it? Well, you can either sit back and do nothing,
And let it happen. Let
and
time take its course.
and then maybe say, I wish I could have done something, or you get ahead of it, right? So in life, it's trying to be as much be proactive about things. Um, at the bare minimum, anyone who's suffering from hair loss should at least be on a good multivitamin every
Mm-hmm.
day, something that has biotin in it, some folic acid. We use and we carry Nutrafol, which we have tried and feel is a very effective multivitamin for hair thinning, hair shedding, hair loss. They have different options for men, women, and then based on your age as well. So
Mm-hmm. Yeah, and it's not that you just take it for a month and then your
mhm.
hair automatically goes back to what it was. It's something that you have to maintain. You have to keep taking it in order to provide those vitamins to grow that new hair.
Yeah, and to touch base on that, I think that is something that patients come in and they'll say they tried this, and my first question is like, well, how long did you try it
Yeah,
for, right?
absolutely.
Because nothing is going to be a 1 week, 2 week, 4 week thing. I mean, you have to, on the bare minimum, do something for at least 12 weeks, because it's about the cycle of hair growth, right? And so there's different stages of hair growth, and everybody at any given point is in the shedding stage,
Mm-hmm.
right? So, what our goal with trying to restore hair, and to make it look more voluminous and to keep less hair from shedding, is to help at that root or that follicle.
Mm-hmm.
And so a lot of the devices that are out there are catering to that now.
Yeah, and there are also prescription serums that you
Mhm.
can use and prescription medication that you can use. But we're here today to talk about TED, which is exciting for our practice. We added it on a little over
A
a
year and a
year
half ago
ago,
now, yeah.
and it was really exciting when we added because it's a non-invasive treatment to help restore
Mhm.
hair loss.
Well, and anything in our practice, I mean, we have a plethora of devices and treatments, but really it's like, I took the time and the diligence to kind of figure out, like, what do we want to use, right? And we were injecting PRP into the hair as an option. The problem is that no one came back for their
Yeah,
second treatment
it
because it was
worked,
so
but
painful.
it hurt.
So it was really hard to say, hey, because no one's really doing their 3 treatments. So what really intrigued me about TED was one, a lot of the leading hair experts in Illinois have that device. So it was very, when I spoke with them, and their success with it, it was kind of an easy no-brainer for me to bring this onto the practice. But I love that it's a non-invasive treatment,
Mm-hmm.
and it's using different technologies. So it's using acoustic sound waves and low frequency ultrasound. And there is a plant based serum. It's a
Mm-hmm.
growth factor serum that they have patented, that is basically what is being driven down into the hair follicle to rapidly start stimulating that hair growth.
Yeah, and what it's like, it's basically you get one pass over your head with this acoustic sound wave device. So it feels kind of like getting a scalp massage. And what that acoustic sound wave is doing is it's opening up the stratum corneum, which is the outer surface of your skin. And so then when you apply the growth serum and do another pass with the acoustic sound wave, you're able to push that growth serum down to where the hair follicles are to stimulate that growth, where normally your stratum corneum would be closed. So if you applied a growth serum, it's not going to actually penetrate down deep enough to reach those hair follicles.
And we do about 5, it's like 5 credit card size
areas
that we can do on your scalp.
So able to target those widow's peaks. And then a lot of people have problems back here at the crown of the head as well.
And it is painless, right? I mean, I've done it a couple times, and I would never, I mean, I'm the biggest baby out there.
He is, yes.
So the fact that I can tolerate it, I know anyone else can tolerate it. And that is the key. Like we said, even if you're taking a multivitamin, you have to take it for 3 months. If you're doing this treatment, the recommended FDA approval suggestion is 1 treatment a month for 3 months, and then based on your
age, your demographics,
severity,
your genetics, that kind of stuff.
It might be you do it again at 6 to 9 months, and then you're doing 1 every 6 to 9 months as a maintenance, right? So it's a lot easier for someone to do this treatment because, one, there's really minimal downtime other than no washing your hair that night.
Yep.
We always tell, if you want, you can wear a baseball cap, or you can go home with that, and you can still go around your normal activities. But we just say don't wash your hair that evening. But most patients are seeing a difference at 3 to 4 weeks, right? And so
so you should notice less shedding at 4 weeks, then thicker hair growth at that 8-week mark, and then at 12 week is where we start to see the more sparse patches starting to fill in.
And we, I mean, if you're a patient of ours and you're in our office, I mean, there's a lot of our staff that have already done it and have had great results with it. There's no one that has come back to me and said, like, I don't think I see a difference, right? Like, so that it makes me feel really confident telling you guys about it. It's something to try. And again, if it's something that bothers you, it's like you have to try something. You have to do it.
Yeah, and as we touched on earlier, like the earlier the better. So when you're starting to notice the changes, that's when you want to get on top of it. Or you can wait and then you can go to Turkey and get a hair transplant one day. But if you start on it earlier, then you're going to get better results in the long term.
So touching on that, Turkey is the mecca of hair transplant.
Yeah.
And from a cost perspective, I mean, you have to do your diligence and your research and make sure you're going somewhere and know someone that's done it. But that often is when there is no, a treatment like this wouldn't even make sense, right?
Yeah.
So we say is if you're completely bald and there's no little peach fuzz or hair in that area, then TED, the treatment that we have, is not a treatment choice for you because we're already a little bit too far gone. Right. But if you're starting to see shedding, I mean, this is so effective in women. And
we have quite a few 20-year-old males that have done it where their fathers went bald at 40. So they're starting early in their 20s. And then women in general, like we are so about hair and hair volume and hair extensions and all that kind of stuff now. So it's very effective in terms of like thickening your hair, getting increased hair growth. Widow's peak's always an area of concern for women.
Yeah. And also the type of hairstyle you have, or if you're constantly in a ponytail, or you're pulling back, or you're braiding
braids,
that is going to do damage over time to your hair. So the goal of educating you guys out there is that there is a non-invasive treatment option. It's very painless. It's quite maybe about 20 to 30 minutes is how long the procedure takes, and it's effective.
Yeah. And maybe you don't suffer from hair loss or hair shedding, but maybe a loved one or somebody you know does. So if you do, send them our way. We can definitely help them.
Good time to try it out.
Yep. So give us a call. Thanks, guys.